Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. We're going to be continuing the visceral series today by talking about the liver and the gallbladder. Now, if you've listened to the podcast, you'll know that I mentioned the liver on multiple occasions because it has such a huge impact on multiple parts of the body. It has effect on the upper extremity, the lower extremity, fertility, how digestion's working. It's really an integral part of how the body can function. So like the stomach episode and esophagus episode, we're going to talk about first, what are some sort of like medical clinical findings you might have if you're having issues with your liver and your gallbladder. So what are some of the true medical reasons why someone might come in to my office and have me mobilize their liver for more of a visceral standpoint? And then we're going to talk about what are some of the musculoskeletal findings. So what sort of limitations will you find in your body if the fascia around the liver and gallbladder are stuck? And finally, we're going to talk about different treatment strategies you can do on yourself to help mobilize the liver and the gallbladder. So let's first start talking about the liver. Now, the liver is first physically huge, but then also has a ton of jobs. It has over 500 jobs that it does. 500. That liver is a crucial part of your body's overall function. It's in charge of detoxifying your blood, for hormone balances, for storage of nutrients. It works on, heat regulation of your body. There's so much that the liver has to do. And so if you have someone that's having liver issues or you yourself, the first thing you might want to see is that how your liver function tests are, or your LFTs. This is usually part of your general kind of yearly blood work. So most likely they'd be looking at your ASTs and ALT levels. And that kind of just tells us how overall your liver is doing. Another kind of emphasis on if the liver's functioning well is looking at your triglycerides and your cholesterol levels. So if those are kind of all out of whack and you can't seem to get them down, you try medication, it could be that liver isn't able to function properly. It's not able to move, right? With the visceral mobilization, we are looking at movement around the organ, around that fascia, so that everything inside of it can do its job. So if you'll see patients that have issues with their cholesterol and triglycerides will actually improve with mobilization. I mentioned briefly when I talked about the effects of visceral manipulation kind of at the beginning of this series of episodes about a patient of mine that I treated via telehealth. So I taught her how to mobilize her own liver. And she actually posted on Instagram the difference in her liver values before and after when nothing else had changed and they had been in an elevated state for really high. So it is amazing how you just get that organ moving properly, that fascia around it, so that the organ can kind of move and groove and do what it's supposed to. So the liver has a lot of different functions to it. So really, if you're wondering if you need to have your liver mobilized, it could be that you just can't seem to get any better with those liver function tests, that blood test, and looking at those triglycerides. So those are some of the kind of functions of the liver in terms of a medical standpoint that I'd be seeing somebody. Now, when it comes to the gallbladder, that little gallbladder, its job is to hold bile. So now this is an organ that can be removed. There's like the appendix can be removed and you'd be fine. And the gallbladder can be removed as well. So the way that I talk about the gallbladder is it's basically just a deflated water balloon. And in that deflated water balloon, it holds bile. Now, bile is what dissolves fats in through your system. So after you've had a big meal, it doesn't matter what the fat is either too. Because sometimes when I talk about if people are having issues with their gallbladder, I ask about what their diet is and they're saying, oh, I eat really healthy. But like an avocado toast, definitely healthy to have. Guess what? That avocado is a lot of fat. And so when you eat something that has a lot of fat content, what your body does, it has a storage of bile that's in the gallbladder and it injects it into the intestines so that it's able to work and dissolve the fats. So if you're having issues and kind of have pain when you're having fatty meals, especially pain between your shoulder blades. So it's a referred pain that you'll get from your gallbladder, and it'll go in between your shoulder blades. So if you've had a fatty meal, if you've had In-N-Out Burger, because I'm in California, so we're all about In-N-Out Burger, or if you've had avocado toast, or you have something with a lot of coconut, or just anything that has a lot of fat, and you're having pain about, an hour or two after your meal, it could be that the gallbladder is affected. Another fun fact about the gallbladder, and I think I mentioned this during my pregnancy podcast, but maybe I didn't, is that bile that the gallbladder is storing is also what gives your poop its brown color. So if you don't have good injection of bile into your small intestines, you'll actually have a lighter colored poop. So poop should be a nice medium brown color. Anything less than that is actually showing that there's not enough bile in there. So when I teach the visceral course for the Institute of Physical Art, I talk about my own personal story because I give patient demos and patient examples just to kind of put into people's minds what sort of person you'd be treating this organ for. So I actually myself was my own patient when I was pregnant. I was about 28 weeks pregnant, and my daughter had long limbs and hated to have her legs kind of squished up in here. So she was always stretching her legs. And I remember getting a swift kick to the upper right quadrant of my abdomen, and that's right where the gallbladder was. It was really painful, and I just remember being really sick for the next day or two. Now, I had a rough pregnancy to begin with, so it wasn't too alarming to me that I wasn't feeling so well. I was feeling a little nauseous until I had a bowel movement, and it was white, like actually white as the toilet bowl. And that freaked me out at first, for sure, being like, what is happening to my body? But then I remembered about the gallbladder and how it's what gives its poop the brown color. So the fact that I had white poop is because I had a gallbladder obstruction. And that's why I was so sick during that period of time. So I actually used some of the techniques and treated my own gallbladder, got it flowing again, and I felt so much better. So this is a story that I will hold over my daughter's head from now until kingdom come, because she kicked and obstructed my gallbladder at 28 weeks pregnant. Yes, my daughter is very tall with very long limbs and is very strong kicker. So gallbladder, if you start to have lighter stools or you're having pain with fatty meals a couple hours after having a fatty meal, it could be your gallbladder that is the issue and it needs to be mobilized. So those are some of the kind of more medical pathologies that you would want to have looked at if, you'd want to have your liver or your gallbladder assessed if you're having issues with. So now let's talk about the fun thing. Let's talk about the musculoskeletal dysfunctions you'll have if these organs are not moving correctly. I think maybe first I should talk about how big the liver is, because it is massive. It still blows my mind how big it is. And then this will also kind of tell you why it has so much effect on the body. So the top of the liver actually starts between the fourth and fifth rib. The fourth and fifth rib, that's not very far down your chest. I always say it's kind of around nipple line is where it starts at. So that's the top of the liver. So it's a little higher than the stomach, actually. Stomach's a little lower. Stomach is between fifth and sixth rib. The liver is between fourth and fifth rib. And it actually goes all the way across. So it starts on the biggest part is on your right-hand side. But there is your left lobe of the liver, because you have two lobes, that goes to the other side. And actually, if you draw a line halfway down your collarbone on the left-hand side, down to that fifth and sixth kind of rib space where the stomach is, that is where the edge of your liver is. So the liver's kind of going from that midpoint down your collarbone at that fifth, sixth rib, and it goes across and it follows down the lower border of your rib cage all the way back, and it's front to back. The stomach is just the front half of your abdomen. The liver is the front and the back. So again, this liver is massive. You can also, fun fact, you can donate half of your liver. You can donate a lobe of your liver to someone that needs a liver transplant, and it will actually regenerate itself. Fun fact about the liver. The liver is amazing. So the liver is huge. So you can only imagine how it will have effects on both sides of the body. So sort of musculoskeletal issues you might have going on if you have an issue with the liver, if the liver's not moving properly. You're going to have really limited rib cage motion because it's covering like, I would say close to 60 or 70% of your rib cage, like from the nipple line down, is liver. So you're going to have limited rib cage range of motion. You might be able to be limited from kind of side bending from front to back, extension, taking a deep breath. There's so many things about your rib cage that can be limited in mobility if the liver is stuck. Right shoulder range of motion will be greatly affected, especially when you're kind of coming up and forward. I don't know how many of patients that I've treated that have like shoulder impingement where they feel all the pain in their shoulder joint. But when I'm looking at them moving, I'm seeing that their rib cage isn't moving. Their rib cage isn't lifting up and kind of going into extension when they lift their arm. And that is what's leading to that impingement in the shoulder. So if you treat the liver, all of a sudden range of motion of the shoulder increases remarkably if, one of those big restrictions that's limiting it is the fascia around the liver. So you'll see big range of motion changes in the right shoulder especially. You'll also have pain, kind of that right flank pain, which that makes sense, that lower back rib cage because the liver is there. So if that's restricted, you'll have pain there. So it's not necessarily the kidneys. You can also get some range of motion issues and stiffness in through the cervical spine as well. So in through your neck, you'll have some range of motion issues. Now let's talk about the gallbladder. So the gallbladder is this fun kind of anatomical anomaly in terms of interesting things that can be going on with it. Now, I love teaching about treating the gallbladder because the eyes that light up in the crowd when they see the improvements of their range of motion that they did not expect whatsoever from the gallbladder is pretty phenomenal. So here is some fun anatomy about the gallbladder. You have your phrenic nerve. Now, your phrenic nerve is the nerve that innervates your diaphragm. You have your right and your left. It's what allows your diaphragm to go up and down. Now, it doesn't just stop in your diaphragm. It actually goes past there because your diaphragm's up above your liver. But the nerves go down into your abdomen, and that left one actually, once it goes into your kind of abdomen down by your stomach, it actually goes straight across to the right-hand side and meets up with the left one right at the bottom of the gallbladder. Crazy. So limitations of the gallbladder specifically will lead to pain on the left side of your body. So you'll see left-sided neck pain, scapular pain, kind of eye tension. You'll see that the left shoulder range of motion is limited or rotating your head to the left is limited, all from a gallbladder mobilization issue. Like, that's just crazy to me. I think it's so cool. And you see so many skeptical people when you're like, I know that it's your left shoulder that's bothering you, but I'm going to go and treat your gallbladder, which is on your right side of your body, and we're going to improve the mobility of your shoulder. They think you're crazy. Well, let's be honest. My patient thinks I'm crazy a lot of time because I get excited about things like treatment of gallbladders. But it really is amazing to see how just understanding that anatomy, that kind of like little pinpoint thing that you wouldn't even think about, but actually has huge impacts on the body because, hierarchy of the organ systems, right? If that nerve can't work efficiently and that nerve is to help you breathe, breathing is kind of vital for survival. Then if there is that irritation around the gallbladder, if that mobility isn't there and it's pulling on that phrenic nerve, it's not going to allow the diaphragm to move very well. And that's going to lead to a lot of other issues. And so you'll find a lot of protection around that area and you'll have limited shoulder range of motion and even rib cage range of motion because it's just trying to protect that nerve that's crossed over to the other side of your body and just ended at the spot right by your gallbladder. So you'll see a lot of left-sided issues with the gallbladder. Right side is liver, left side is gallbladder, even though the gallbladder is also on the right side of your body. But it's just about this kind of anatomical, just fun fact, little tidbit of that phrenic nerve that leads to all that left-sided issue with the gallbladder. What I didn't mention about the liver, and I'll kind of go back to here in a second, is that I mentioned upper extremity issues. There's a lot of lower extremity issues that will also come into play with a liver issue. And that is because of all the vasculature, all the vessels, the arteries and the veins that are leaving the liver and going down into the abdomen. Now, remember, I said one of the jobs of the liver is to detoxify the blood. So there's got to be a lot of blood flowing into it. And then that newly purified blood has to flow out of it. So there's a ton of blood flow that is occurring in and out of the liver. And all of that vasculature is going into all the different parts of your intestines and down into your pelvic floor. So this is why the liver is really important for blood flow, especially for females to the uterus. If I'm treating a woman that's dealing with fertility issues, I'm going to be treating the liver, especially if they don't have very strong periods, if they don't get a lot of blood and they've been told that there is limited blood flow down into their pelvic floor. I am going after liver. I am trying to mobilize the liver to increase that blood flow down there. Now, concurrently, if there is an issue with that blood flow, it could be that not only blood can't get into the liver, but that blood's pooling outside of the liver. So that blood that's left there is just kind of holding into the pelvic girdle. So you'll actually get patients with SI joint pain, low back pain kind of down there in the pelvis because of a liver issue. But yet again, it's the vasculature from the liver and that kind of congestion of the blood that will lead to those issues. So there's a lot that can go on the lower extremity as well if that liver's not moving right. Not just because, if you think about someone, you see someone running, there's a lot of extension that's happening through their lower body. If that liver's not moving correctly, if it can't mobilize, then you won't see as great leg extension on the right-hand side. But just be aware too that because of that vasculature, there can be issues right there in your SI joint and pelvic floor area. So the liver is really crucial for patients dealing with pelvic floor problems that just don't seem to be going away. Now, is the liver the first place I go to if someone has a pelvic floor issue? No, because they look like me, like I'm absolutely crazy if I'm just going to say, I know your issues in your pelvic floor, but I'm going to go ahead and treat the liver. No, it's one of those things I'm looking at later after I'm already kind of clearing up what's happening in the pelvic girdle area or the pelvic floor. But it is an area that you need to be concerned with if they just don't seem to be getting better, or if there's a big vascular component to their issue, or if you're the patient, your issue. If there's just kind of this congestion that you've been told about, you want to go after and treat the liver. So the liver is going to be crucial for that part too. So the liver's got a lot going on, and so does the gallbladder as well. Now, what do we do about it? How do we treat it? How can we effectively go after that liver and get better mobility? Now, I want to teach stuff that you can do at home that I feel like safely you can do at home. So we're going to talk about that because obviously if you're in the clinic with a therapist that knows how to treat the liver, they're going to be treating it in all different angles and kind of positions to get mobility. So I want to give you more what's the best bang for your buck. Now, even though, because we talk about in, the courses of, does the liver go down? Can it go down? Can it lift up? Can it go right? Can it go left? Can it roll? All these different kind of positions. What's going to give you the best improvement, kind of regardless of what the dysfunction is trying to lift your liver up. You want to be able to kind of pull your liver up into your ribcage more and stretch all that fascia going down, especially you're going to be stretching all that vasculature. So really doing a liver lift technique is going to give you the most improvement regardless of what your liver dysfunction is. Because let's be honest, I'm not expecting you to be able to understand just listening to this podcast, which way is my liver not moving? No, I have to teach that to physical therapists and we have to go over and over and be able to explain it. So I'm not expecting you, the listener, to be able to understand it. So just doing a liver lift technique is going to give you the best kind of improvement in range of motion. So the way that you do a liver lift technique is you would want to be in a sitting position where you could really kind of slouch down and be in terrible posture. And what you want to do is you want to have your hands along the lower part of your ribs. So you want it to be that your kind of pinky and ring finger are underneath the ribs on your right hand side. And then your middle finger and your index finger and your thumb are up on your rib cage on the right hand side. Now, as you kind of bend forward and slouch down, really poor posture, you're going to change the angle of your hands so that you're trying to almost like create a shelf underneath that liver to try to lift it up. So when you start, your hands are laying on flat on your abdomen. And then as you kind of bend over in poor posture, you change the angle so that your hands are now kind of karate chopping into you. They're perpendicular to your body. And you got to sink your hands back, and you got to sink them back and sink them back, because remember, that liver is going all the way from the front to the back. The stomach was just the first half, like the front half of the body, but the liver is going all the way back. So you really have to sink your hands really far back. Now, if you feel nauseous while you're doing this, lay off, don't go as deep. Just kind of slowly go in, try to let your body let in. When you feel like you've got a good depth, what you're going to do is, still staying in that position, you're just going to bend your elbows to try to lift up that liver. Now, you might feel some good tension underneath your hands when you're there. So if you're in that position and you're trying to lift up and you feel that tension, you can just hold there and just try to lightly breathe into it. Don't breathe too heavy, because remember, your diaphragm's right above there, but you can kind of breathe light into it. You can also keep that kind of upward motion, bending at those elbows, trying to pull that liver up towards your head. And you can maintain that while you try to do like some trunk rotation. So you can try to rotate your body to the right. You can rotate your body to the left. See whatever kind of makes it jump into your hands a little bit more, where it feels a little stiffer, a little bit more painful. Now, you can also, really, rotation's going to be your best bet. You're going to get most of that, but you can also then try just lifting your head up. So staying in that slumped over position, karate chopping into your body, lifting up on your liver. You can try just looking with your head, like trying to tilt your head back behind you. What if you kind of tilt it back over to your right shoulder, back over your left shoulder? Feel for wherever it feels the tightest, or you feel like there's a bigger restriction, and just kind of keep going back and forth with this. You're just trying to mobilize your liver. Now, if you wanted to try to do this, if you thought this might, like, if it was a shoulder range of motion, or if it was a leg range of motion or rib cage, whatever it is, make sure that you test what that limitation is first before you mobilize the liver. So let's say if it's your right shoulder, you have some pain when you're lifting your shoulder up. So just kind of lift your shoulder up, feel how it feels, see what the range of motion feels like. Is there any pain? What is the limitation there? Then treat the liver out, do this liver lift technique, and then stand up again and try moving your shoulder and see if it's better. Now, if the liver is a component to your musculoskeletal dysfunction, then you'll see improvement in there. You'll see that your shoulder can move a little easier. Maybe you don't have that pain in the AC joint at the end of range. You don't have that impingement syndrome going on. So that is the liver lift technique. I think that's what's going to give you the most bang for your buck in terms of the liver. Now let's talk about the gallbladder. Great way to get the gallbladder moving is to do this kind of milking technique. Now, if you're someone that has also been told you have gallstones or you have sludge, this is actually a great technique to do to kind of get everything moving through your gallbladder. So if your gallstones aren't really serious where you have to have your gallbladder taken out, which you would know because you know what a gallstone attack is like if that is your issue. But if you feel like you just have some mild sludge in there, then you can go ahead and treat this in this milking technique, especially if you're about to have a fatty meal. So if I have someone that's going to have a fatty meal, like I said, regardless of what the fat is, because it can be good fat or bad fat, your body just sees fat and needs to inject the bile. Whatever it is, you might want to do this mobilization technique after you eat, or but right before you eat, whatever kind of works out timing wise. Either way, we just kind of want to open up and get bile moving through there. So the way to do this milking technique to the bile, the gallbladder, remember I talked about how the liver was kind of, you drew a line halfway through your collarbone on your left-hand side, and that's kind of the end of the left lobe. Well, the gallbladder is if you draw that same line, but on the right-hand side, and you go and kind of follow that line down to the bottom of your rib cage. Now, if you're at that line, you want to then just go down, feel for the bottom ribs along that, what we call the mid-clavicular line, or kind of the middle of the collarbone. Draw that down to the bottom of your ribs. Then you're going to go down about an inch, inch and a half from there. And you're going to have your right hand over your left hand. You're just going to have your finger pads on that area. So yet again, you're that midclavicular line about an inch and a half below the lower border of your ribs on the front of your body. You're going to have your right hand and your left hand finger pads over there. And what you're going to do is going together, you're going to move your fingers going up towards your head. And then you're going to go kind of push them in towards the back of your body, then go and pull in towards the center and go down. So we go up, back, in, and down. Up, back, in, and down. So it's like a little circular motion. So your finger pads should never leave where they are on your skin. They shouldn't be sliding over your skin. They should be staying at that same place. And what the idea, what you're trying to do is that you're trying to lift the bile out of that deflated water balloon and push it in through your system. So you want to go lift up and then back, down, and in. Up, back, down, and in. Now, when you first start doing this, because you don't have to push very far, the gallbladder is pretty superficial, so you're not going very far into your abdomen at all. You'll feel that there's like a resistance when you're moving this motion, this circular motion of the up, back, down, and in. But then as you start to do it, like maybe after 4 times, 5 times, you'll feel that the skin actually feels like it's lighter, that there's more mobility. And that means that you just milked your gallbladder. Congratulations. You got the bile injected into your small intestine so that you can be able to process the fats from your food. So that's kind of the best technique you can get if you have a gallbladder issue. That liver lift technique that we did right before this will also help the mobility of your gallbladder. But if you have this issue, especially with kind of more of the medical pathology of the lighter stools, and if you have gallstones or issues with metabolism of fats, you want to do this like milking technique. So it's up, back, down, and in, up, back, down, and in of the gallbladder. Well, I hope you guys have a better appreciation of the gallbladder and the liver. If you can't tell, I think that they're extremely important. Like I said, this is one of the funnest organ areas to treat in class because it just is so many like ding, ding, dings in people's minds as to like, wow, I never imagined moving my left shoulder, I would have improvement after I mobilized my gallbladder, but it is possible. So next week, we are going to be talking about the bladder and the prostate, and I will explain why the prostate is really important to get mobilizing for men. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.